Welcome to the deep dive. This is where we take complex stuff, research papers, expert notes, and we boil it down to the key insights. Think of it as your shortcut to getting really informed. So today, imagine this. A condition that costs an industry like tens of millions of dollars every year. It makes animals sick, really productive ones, and it's incredibly hard to diagnose until, well, often until it's too late. And what if I told you it affects some of our most important farm animals, dairy cows mainly? And it often goes by the name fat cow syndrome. But that name, it's actually a bit of a trick. We're diving deep into bovine fatty liver disease today, BFLD for short. We've gone through a whole stack of sources, research articles, vet notes, the works, to really get a handle on this major metabolic disorder.
Yeah, our mission really is to unpack BFLD. We want to understand why it's such a persistent, costly problem for dairy cows and for the whole industry, and then look at the really exciting new stuff happening in diagnosis and prevention. We'll get into the economic hit, the metabolic nuts and bolts, why it's so darn tricky to spot early, and how some groundbreaking research is honestly changing the game.
So stick with us. You're about to get a really comprehensive picture, not just what it is, but why it matters so much. And there are some genuinely surprising things in here. Okay, let's unpack this. All right, so bovine fatty liver disease. At its heart, it's a serious metabolic disorder. We're talking about too much fat, specifically triglycerides or TAG, building up in the liver cells of cattle.
Exactly. And it particularly hits those high-producing dairy cows right around calving time, that whole periparturient period. You might hear it called hepatic lipidosis too, or, yeah, that common name, fat cow syndrome.
Right. And here's where it gets really interesting, that name.
Sure.
Fat cow syndrome. It's pretty misleading, actually. A cow doesn't need to look obese or even, visibly overweight when she calves to have BFLD. The metabolic imbalance, the real problem, can be brewing inside long before you see any outward signs, even in cows that look like they're in perfect condition. So the key thing here is it's often silent, hidden. You can't just eyeball a cow and know if she has it, which makes diagnostics like internal checks so vital.
And that hidden nature, that directly feeds into the huge economic losses. We're talking, like you said, upwards of $60 million a year just in the U.S. dairy industry. And honestly, most projections think that's probably lowballing it. The costs just pile up. You get reduced milk production, obviously. Cows might be slow to peak, or their production just drops off and stays low.
And reproduction takes a hit too, right?
Absolutely. Lower fertility, longer times between calving. That's linked to things like messed up hormones, elevated nephas, those non-esterified fatty acids we'll talk more about, and BHBA, which is related to ketosis.
Yeah.
Plus, and this is a big one, cows with BFLD are way more susceptible to a whole list of other problems around calving time.
Like what kind of problems?
Oh, you name it. Milk fever, ketosis itself, mastitis, metritis, retained placenta, downer cows, even displace abomasums, twisted stomachs. And when they do get sick with something else, if they have fatty liver underneath, they often don't respond well to treatment. They relapse.
Oh, that sounds frustrating.
It is. It leads to higher culling rates, sometimes up to 25% mortality in severe BFLD cases. Bigger vet bills, wasted feed. It's like BFLD sets them up for failure. It's the central metabolic issue that makes them vulnerable to so many other costly problems. It really becomes this self-reinforcing cycle of economic drain, You treat the secondary issue, but because the liver's compromised, you don't get the results you expect.
Okay, so it's not just about being fat visually. What's actually going on inside the cow, metabolically speaking, that causes this liver overload? Well, fundamentally, BFLD kicks off because of a severe negative energy balance, NEBB. This hits hardest right when lactation starts in these high-producing cows.
Right. Their energy needs for making milk just skyrocket, way beyond what they can possibly eat, especially right after calving when appetite is often down anyway.
So the body needs energy, but it's not getting enough from food. What does it do? It starts raiding the reserves. It mobilizes huge amounts of stored body fat. This releases those non-esterified long-chain fatty acids, the nephas, into the bloodstream.
Yeah, they're basically dumping fuel into the system. And those plasma NEFA levels can shoot way up, often over 1,000 micromoles per liter around calving. If they stay high, say above 700 for a week after calving, that's a pretty strong sign of significant NEB and higher risk for fatty liver.
So all this fat fuel hits the liver. What happens then?
Well, the liver tries to process it. It can either burn the nephas for energy, or it can repackage them into triglycerides, TAG. But here's the really fascinating part, the critical thing for cows and other ruminants. They are remarkably slow at exporting this TAG out of the liver.
Slow. Why?
They have trouble making the transport vehicles, basically. These very low-density lipoproteins, VLDL, are needed to ship fat out of the liver, and ruminants just aren't great at synthesizing them compared to, say, us or other non-ruminants.
Ah, so the fat comes pouring in, but the export route is bottlenecked.
Exactly. That limited export capacity is precisely why the tag just piles up inside the liver cells when NEFA levels are high, and it's why the problem can stick around for a while. It's a unique physiological challenge for them.
And that explains why some treatments don't work as well.
Precisely. Those lipotropic agents, things meant to help export fat, they might work in other animals if you give them orally, but in ruminants, the rumen microbes often break them down before they even reach the liver to help. So yeah, that bottleneck is a major factor. And when all that tag builds up, it really messes with liver function.
How so?
It reduces gluconeogenesis, that's the liver making essential glucose. It impairs urogenesis, so ammonia detoxification slows down. Hormone clearance gets messed up, hormones hang around too long, and the liver doesn't respond to hormones properly either.
So you can get knock-on effects like low blood sugar?
Yep, hypoglycemia
Yeah.
or hyperammonemia, too much ammonia, just generally wacky hormone levels. But the thing is, you often don't see clear clinical signs until the liver is already pretty loaded with fat, like 15% or more by weight.
Which brings us back to the difficulty in diagnosis. If it's often silent until it's quite advanced, and the signs aren't specific, how do vets actually diagnose it in a living cow?
Yeah, the clinical signs are often really vague, aren't they? Things like the cow just seems depressed, lethargic off her feed. Exactly. Decreased milk, weight loss, maybe signs of ketosis, not responding well to treatment for other things, reproductive issues. They all overlap with so many other post-calving problems.
Are there any more specific signs, even if they're rare?
In really severe cases, you might see jaundice, that yellowing or photosensitization, getting sunburned easily. Or even neurological signs if ammonia builds up enough to affect the brain, that's hepatic encephalopathy. Sometimes digestive upset or signs of abdominal pain too, but yeah, those are less common.
And you mentioned that masking effect. Can you explain that again?
Sure, so say a cow gets mastitis, an udder infection. That's the obvious problem. But she might also have underlying silent fatty liver disease. Treating the mastitis might not work as well as expected, or she might get better than relapse because that compromised liver function is hindering her overall recovery and immune response. It makes figuring out the root cause really tough.
So traditionally, how have vets tried to diagnose this beyond just waiting for postmortem?
Well, yeah, unfortunately, a lot of diagnoses are confirmed post-mortem. For live animals, blood tests can give clues, things like ketones in the urine, persistent ketonuria,
Okay.
or tests of liver function, like how quickly the liver clears a dye called BSP from the blood. Increased retention means poorer function. Elevated liver enzymes like SDH or AST are markers of liver cell damage. Low serum albumin can also be an indicator.
But you said these aren't always reliable.
Right, that's the crucial problem. Many of these traditional biochemical markers, when you use them one by one, just have relatively low sensitivity and specificity for BFLD. Like the diagnostic accuracy measured by AUC for glucose is really low, around 0.1. AST is better, maybe 0.75, but it's still not perfect. That's why it's historically been so difficult to get a firm diagnosis.
So what has been the most reliable method?
The quote-unquote gold standard is still a liver biopsy, taking a small tissue sample directly from the liver. Yeah, it's definitive. You can measure the exact amount of fat, look at the cells under a microscope, but it's invasive. It's not practical for routine use on a farm. There's a risk of infection. And, as some sources bluntly put it, it further aggravates the suffering of diseased cows. Not ideal.
Okay, so that paints a challenging picture for diagnosis.
Yeah.
But you mentioned things are changing. This is where it gets really interesting, right?
Absolutely. There's been this huge push for better, non-invasive ways to detect BFLD early, precisely because of the economic losses and these diagnostic hurdles.
And that's where metabolomics comes in.
Exactly. Multi-channel metabolomics analysis. It's like a paradigm shift. Instead of looking at one or two markers, it looks at a whole profile of small molecules, metabolites, in samples like blood, urine, or even feces.
And this is more accurate.
Significantly. Research is showing that by combining certain novel metabolite biomarkers found this way, you can get incredibly high diagnostic sensitivity and specificity. Like, finding specific combinations in fecal samples can give an AUC of 1.
Wow, an AUC of 1? This is like perfect diagnosis.
Pretty much, yeah. Same for combining markers from feces and urine. It's a massive improvement.
Can you give some examples of these new markers?
Sure. Things like alpha-aminobutyric acid and behenic acid in feces, or 3-nitrotyrosine in urine. In blood serum, researchers have identified a panel including L-asparagine, palmitoleic acid, L-serine, stearic acid, nonitinoic acid, and petroselenic acid.
These sound quite specific.
They're specific metabolic fingerprints that change when BFLD is present, even early on. There's also work on other serum markers like fibroblast growth factor 21, which seems to go up with liver fat, and hemoglobin, which seems to go down.
So if we connect this to the bigger picture,
Mhm.
what does this mean practically?
Well, the hope is this research leads to practical, maybe even cow-side diagnostic tests. Imagine a simple kit where you could test a manure or urine sample and identify cows at high risk before they get really sick, before the liver damage is severe.
That would be a complete game changer. Proactive identification instead of reactive treatment.
Exactly, allowing for much earlier intervention and potentially heading off those major economic losses and animal welfare issues.
Okay, so let's talk treatment. If a cow is diagnosed, what can be done? You mentioned it's challenging once it's advanced.
Yeah, current treatments are largely supportive, often overlapping with how you'd manage ketosis. But it's true, once the liver is severely fatty, its ability to recover fully is limited. The damage can be hard to reverse.
So what's the main goal of this supportive care?
Primarily, it's about trying to get insulin levels up. You want to trigger insulin peaks.
Why insulin?
Because insulin helps shut down that excessive fat mobilization from body stores and also dampens down ketone production by the liver.
Got it. So how do you stimulate insulin?
For milder cases, oral treatments are common. Propylene glycol is a big one, usually given as a drench or bolus, maybe 250, 300 grams twice a day. Glycerol is another option, sometimes more palatable, maybe up to 500 grams twice daily, though it's generally seen as a bit less effective for the ketosis aspect than PG.
Any others?
Sodium propionate can be used maybe 200 grams twice a day, but you have to be careful because it can worsen alkalemia, which is high blood pH, sometimes seen in these cases.
And for more severe cases?
Then you're often looking at intravenous fluids, specifically IV dextrose, usually a 50% solution. Maybe a single bolus of 500 milliliter or sometimes repeated boluses.
Is that just for energy?
Actually, that's a key point. The main therapeutic effect of giving that concentrated dextrose isn't really the calories it provides directly, it's the strong insulin spike it triggers. That's what helps stop the fat breakdown and ketone production. It really underlines that this is a disease of metabolic dysregulation. For the really critical, complicated cases, sometimes continuous IV dextrose infusion is needed. That's intensive. It usually requires hospitalization.
Okay, beyond direct energy and insulin spikes, what about other drugs or modifiers?
Well, insulin itself can be used, sometimes prophylactically, meaning preventively, because it's so good at stopping fat mobilization. But you have to be careful with dosage to avoid causing hypoglycemia, dangerously low blood sugar. Glucagon is another hormone. It can stimulate the liver to release stored glucose and make new glucose, and it also stimulates insulin release. Monensin is an ionophore, often added to feed before calving, that helps shift rumen fermentation towards producing more propionate, which is a glucose precursor, reducing the risk of ketosis and fatty liver.
What about those lipotropic agents you mentioned before, choline, methionine?
Yeah, theoretically they should help the liver export fat, but like we said, giving them orally to ruminants is generally ineffective because the rumen bugs degrade them. So, if they're used, IV administration is sometimes suggested to bypass the rumen, but the practicality and cost-effectiveness are debated.
So that's the current toolkit, more or less. But what about the future? You mentioned some innovative breakthroughs.
Right, this is where research is getting really interesting, moving beyond just supportive care.
Tell me more.
There's work on gene-targeting drugs. For instance, a small interfering RNA, or siRNA, drug called SIMCJ. The idea is to specifically silence or downregulate a protein in the liver mitochondria, MCJ, that seems to inhibit fat burning and contribute to fat buildup.
Wow, like a genetic switch.
Sort of, yeah. Targeting the process at a molecular level, it's still being tested, of course, to find doses that are effective but also practical and affordable for farm use. But it's a very targeted approach.
What else is emerging?
Probiotics and manipulating the gut microbiota. This is a really hot area.
How would that help the liver?
The thinking is that by improving gut health, modulating the bacteria, strengthening the gut barrier, reducing inflammation originating from the gut, you can positively influence liver health and metabolism. Specific strains like Bifidobacterium, Lactobacillus, Lomocilactobacillus have shown promise in studies for reducing fat accumulation and oxidative stress in the liver.
That sounds potentially less invasive, too.
Exactly. And it's often seen as a potentially lucrative choice because probiotics can be relatively available, cost-effective, and generally don't have severe side effects.
Anything else on the horizon?
There's also research looking into microRNAs, like miR29. These are tiny molecules that regulate gene expression. It seems miR29 levels change in fatty liver, but the findings are a bit conflicting right now. Some studies show it goes up, others down. So it highlights the complexity, but it's another area of investigation into the underlying molecular controls.
So it really feels like a shift is happening, moving from just managing the energy crisis to trying to intervene at a more fundamental molecular level.
That's exactly right. These novel approaches are aiming for more targeted interventions, getting at the root causes or the regulatory pathways involved in lipid metabolism, rather than just providing generalized energy support after the fact. It's a real evolution.
Which, given the difficulty and limitations of treatment, really underscores the importance of prevention, doesn't it?
Absolutely. Prevention is, without a doubt, the paramount strategy here. If you can avoid severe fatty liver in the first place, you bypass all these challenges.
And the key focus for prevention is?
It's all about optimizing management during the dry period, that time before calving, to minimize the severity and length of that negative energy balance after calving. Our sources consistently point to the critical window being about 1 week before calving through 1 week after. That's when management really counts.
A big part of that is body condition score, right? Getting the cows to the right condition at calving.
Yes. That's crucial. The target is generally a body condition score, or BCS, of 3 to 3.5 on the typical 1 to 5 scale when the cow calves. Not too thin, not too fat.
Now, this raises an important point, a nuance maybe. What about cows that are overconditioned coming into the dry period, say a BCS of 4 or more? Should you put them on a diet then?
That's a great question, and the answer is actually no. This surprises people. You should not severely restrict feed for already fat cows during the dry period.
Why not? Seems counterintuitive.
Because doing that restricting feed in an already fat cow actually forces her body to start mobilizing that excess fat before she even calves. It basically kickstarts the fatty liver process early.
So you're making the problem worse by trying to fix it too late.
Precisely. The goal isn't crash dieting fat cows in the dry period. The goal is managing nutrition year-round to prevent them from becoming overconditioned in the first place. If a cow is too thin, say DCS 2.5 or less, then yes, you should give her extra energy during the dry period to build her reserves.
So it's about hitting that sweet spot at calving, ideally through consistent management beforehand.
Exactly. And it highlights that BFLD isn't just about one feed ingredient, it's influenced by the whole management system.
What else falls under that umbrella of preventative management?
A lot of things. Avoiding abrupt diet changes, making sure feeds are palatable so cows eat well. Crucially, preventing other periprurient diseases, milk fever, ketosis, etc., because anything that makes a cow sick will reduce her feed intake and worsen that negative energy balance.
Makes sense.
And minimizing stress is huge. Heat stress, overcrowding at the feed bunk, social stress, anything that discourages cows from eating or adds physiological strain. Providing a comfortable, perhaps separate calving area is also important.
So it really takes a holistic view of the cow's environment and health status.
It really does. A comprehensive approach is needed.
Are there specific things you can give cows preventively, like supplements or treatments?
Yes, there are prophylactic measures. Those gluconeogenic precursors we mentioned for treatment can also be used preventively. Drenching propylene glycol, maybe 300, 600 milliliters a day in the last week before calving, can help reduce NEFA levels and lessen fatty liver severity. Glycerol can also be used.
What about monensin?
Yes, adding monensin to the feed for about 4 weeks before calving is a common strategy, particularly helpful for cows considered higher risk, like older cows or those that might be slightly overconditioned. It improves rumen energy efficiency.
And choline.
Ruminally protected choline is another one. Because it's protected, it can get past the rumen and potentially help the liver export fat as VLDL, reducing accumulation. Insulin and glucagon also have some prophylactic potential, though maybe less commonly used just for prevention.
And those newer areas like probiotics.
Emerging, yes. The idea of using specific probiotics during the dry period or early lactation to modulate the gut microbiome, improve lipid metabolism, and boost immune status is definitely gaining traction as a potential preventative tool.
Interesting. Any other preventative ideas being explored?
Some research has even looked at shortening or completely eliminating the dry period for some cows, trying to reduce that period of intense metabolic shift associated with starting lactation. It's complex, with potential impacts on subsequent lactation, but it shows people are thinking creatively about minimizing that NEB challenge.
Okay, so let's try and bring this all together. We've covered a lot of ground. What's the core message here?
Well, it seems bovine fatty liver disease is way more than just a fat cow issue. It's a really complex, economically damaging metabolic problem deeply tied to the massive energy demands of modern dairy cows, especially around calving.
Exactly. And it's compounded by that unique physiological quirk in ruminants, their difficulty exporting fat from the liver. That's a key piece of the puzzle.
Right. And diagnosing it has been tough, relying on vague signs or invasive methods. Treatment helps, but can struggle once the liver is severely affected.
But the exciting part is the shift we're seeing. These new non-invasive diagnostic tools, based on metabolomics, look incredibly promising for early detection. Finding those specific biomarkers in urine or feces, that could really change things on farm.
Yeah, moving from reactive to proactive.
And the treatments are evolving too, moving beyond just supportive care towards really targeted therapies, gene-targeting drugs, harnessing the gut microbiome with probiotics. These represent a more sophisticated approach to tackling the disease at its roots. Still, despite all the exciting new science, the message seems to be that prevention really is the best medicine here.
Absolutely. Meticulous management during that dry period, getting body condition right before calving, minimizing stress, preventing other diseases, that comprehensive holistic approach remains the most effective and ultimately the most economically sound strategy.
It makes you think. Given this incredibly complex web of interactions we've talked about, from molecules inside liver cells to gut bacteria to feeding strategies to the cow's environment, maybe the biggest lessons aren't just in the fancy biology. What if a huge part of managing diseases like this lies in truly understanding and nurturing the animal's entire ecosystem? Everything from her gut microbes right up to her social group and surroundings. Something to ponder. Well, thank you for joining us on this deep dive into bovine fatty liver disease. We hope you found it insightful. Keep exploring, keep learning.